Hello everyone, I am Sandra May Ibranyola from BSN 111A, and today I am going to perform the obtaining of vital signs. The accurate measurement of vital signs is crucial, for it is considered to reflect the body's basic functioning and serves as the baseline for tracking the changes in the patient's state, such as recognizing the patient's deterioration up until to preventing potentially damaging errors. In taking vital signs, it includes heart rate, blood pressure, temperature, and respiration rate. The paraphernalia needed are stethoscope to use to hear the heartbeat of the patient, a digital thermometer to measure the patient's body temperature, a sphygmomanometer to measure the blood pressure, a watch to measure the pulse rate and heart rate of the patient, and of course, alcohol for disinfection while assessing the patient. Prior to the procedure, I am going to close the door to ensure my patient's privacy and provide adequate lighting for patient's comfort. But before all of that, I am going to introduce myself first and verify your identity as well as explaining the procedure that I am going to perform. Good morning, ma'am. I am Sandra May Ibranyola, your student nurse for today. And please state your complete name.
Francis Dayan Elalon.
Your birthday and civil status, please.
January 6, 2004, single.
Okay, thank you very much, ma'am. But before we proceed of obtaining your vital signs, may I ask, what should I call you?
Dayan.
Okay, Ma'am Dayan, I am going to start first with taking your body temperature. In taking the patient's body temperature, it is considered as significant, for it shows the balance of heat produced by the body and heat loss of the body. There are few sites that we can able to collect all those measurements, but today I am going to address the oral and axillary site in terms of taking my patient's body temperature. But first, I'm going to disinfect my thermometer. Okay, Ma'am Dayan, I'm going to put this in your mouth and put it in your, just beneath your tongue, in order for me to get the right body temperature. Is that okay with you?
Yes.
Please open your mouth. While we wait for the thermometer to beep, the beeping sound will indicate my patient's body temperature that has already been obtained. Following that, I am going to inform my patients regarding with her temperature and disinfect the thermometer once again. Okay, ma'am, I will just remove it. Your body temperature is 37.6 degrees Celsius, which indicates that it is within the normal range. I will just disinfect this thermometer and record the data that I have gathered in the patient's data sheet. So we've done doing the body temperature orally. We'll move on to the axillary site of my patient, and I'm going to use another digital thermometer and disinfect it first, as well as performing a hand hygiene. Okay, Ma'am Diane, I need you to pull your sleeves up in order for me to put this digital thermometer. But first, I am going to check if there is any signs of skin lesions and pat dry the area if it is wet or moist. So since there's no skin lesions and it is neither moist or wet, I am going to insert the digital thermometer. We will wait for a few minutes till the thermometer beeps, which indicates that it has already taken my patient's body temperature. Naturally, I will inform my patient regarding with the result and once again, disinfect the thermometer.
Yan, ano yan? Ito ka?
Okay, Ma'am Diane, I need you to move your arm a little bit. So your body temperature is 36.6 degrees Celsius. It is vital to understand that the axillary temperature is 1 degree lower than the oral temperature. I will just have to disinfect this and record the data that I have gathered in the patient's data sheet. So now we'll proceed to taking my patient's pulse rate. The pulse rate, it is the wave of blood created with the contraction of the left ventricles in the heart. In order for me to measure the pulse rate of my patient, I will gonna do a palpation through the 9 pulse sites. But among those, I am only going to palpate the radial pulse, where it is the easiest way to locate a pulse rate. So now, Ma'am Diane, we're done taking your body temperature. I will be going to assess your pulse rate. Is that okay with you?
Yes.
Okay, so I'm gonna need your hand, please. To locate the pulse, I need to use my 2 fingers and trace your thumb and place my fingers in this particular area of her wrist and feel the pulse. It is vital to understand that I am not only counting for the beats per minute, but I am also assessing the intensity of her pulse, which can be measured in 0 to 3 plus scale. 0 will be representing no pulse, 1 plus will denoting a weak pulse, 3 plus will be denoting a pounding pulse, and 2 plus will be denoting a normal pulse. I also need to determine the rhythm if it is regular or irregular. So now that I have located the patient's pulse rate, I am going to count the beat per minute. Okay, Ma'am Dayan, your pulse rate is 81 beats per minute within the normal range and has a regular rhythm. After doing the procedure of taking my patient's pulse rate, I can just simply proceed with taking her respiration rate without removing my two fingers in her radial pulse. And I can just simply look at the rise and fall of her chest, not to make the patient uncomfortable, but to count the breathing. So now we'll proceed with the respiration rate. Respiration rate, it is a simply person that can breathe in a minute and usually done in if the person is at rest. But prior to the procedure, I am going to perform first a hand hygiene. Okay, Ma'am Dayan, I'm gonna need to evaluate your respiration rate and I need you to be relaxed and comfortable as much as you can. So, can you place your hand here as I do a palpation here and count your respiration rate. Try to breathe in and out relaxing. Okay, Ma'am Dayan, your respiration rate is 15 breaths per minute. It is rated with a 0 to 2 plus scale, which denoting a normal plus pulse, and it has a steady rhythm and a regular heartbeat and a laborious breathing. So after doing the procedure, I am going to collect the data and put it in the data sheets. So now we're down to taking her blood pressure. The blood pressure, it is a circulation of blood in the arteries wall and can be measured through sphygmomanometer and stethoscope. Since the patient is sitting, I need to make sure that both of her legs are on the ground and not crossed, because cross leg will just give us a high pressure reading. And place her arm in an arm level, because the low level of arm will just give us a high pressure reading, where areas the high level of arm will give us a low pressure reading. To measure the blood, I need to put the cuff. I need to put the cuff in the center of her arm, just above 1 inch with the antecubital area. I will place the belt side of the stethoscope, for the belt is at best for picking a lower pitched sound. As I inflate the cuff, as I inflate the cuff until I can no longer hear her brachial artery, and listen closely as I deflate the cuff for the initial click, so that I can have the correct blood pressure reading.
Gusto mo ito bawas dito?
Her systolic pressure will be the first initial click, and the diastolic number will be the period of silence until I heard the last beat. So, your blood pressure, remember yan, is 110/80 millimeters of mercury. It is considered as a normal range prior with your age. So, thank you for your cooperation. So, now that I have taken all of her vital signs, all I do now is to disinfect the paraphernalia that I use in this assessment. So that would conclude my obtaining return demonstration of obtaining of vital signs. Thank you.